So, hold on, it's acting up. All right, so I think we're working now. All right, hey you guys. So just really briefly, I wanted to come on and do a few practice questions, maybe 2 or 3. I finished early with the cram session, so I wanted to get into this. But before we get started, as I wait for you guys to join, I want to explain what the courses include, okay? So what I explained to the person doing my cram session earlier today was cram sessions are best right before you take boards. So I want you to be able to have already been studying, have an idea of your areas, and then right before boards, this is like for us to hit through and see, if you have the content, if you need to go over a certain area, that's what my cram sessions are best utilized for. If you're in the beginning of your studies, just get the review course with the videos. You're paying around but basically the same price, the exact same price. And you're going to get more bang for your buck because you're going to be able to watch the video consecutively. You'll get some practice questions, and then broken down by systems, and you can do it at your own pace. When you're starting out the study, you don't need me to quickly go through something with you. But when you're getting ready to test, that's where it's beneficial so you can test your knowledge. So I just want to say that really quickly because that's what we went over today in that session. But let's do a couple of questions since I have some time. So question number 1 states, Ms. Hall presents with her 2-year-old daughter. As the nurse practitioner completes the assessment, it is noted that the patient has a tongue with a strawberry-like appearance. What is the best diagnostic exam that the nurse practitioner should consider? A CAT scan, B, a chest x-ray, C, an echo, or D, none of the above? Again, we're just doing questions from my review book. So what do y'all think? Is it A, CAT scan, B, chest x-ray, C, echo, or D, none of the above? So they present with this 2-year-old little girl. As the nurse practitioner is assessing the patient, they notice a strawberry-like appearance to the tongue. So what is the best diagnostic exam? What do you think about? Give y'all a few more seconds, and if not, I'm going to tell you. Okay, so you want to get an echocardiogram, correct? Because this is indicative of potentially being Kawasaki disease. So with Kawasaki disease, one of the common symptoms, and I say know those key symptoms, strawberry tongue is a key symptom with Kawasaki disease. We do the gold standard echocardiogram on them because the vasculitis can cause heart murmurs. So you want to be sure that this is not, what's occurring here in the situation. So for this scenario, you want to utilize echocardiogram and make sure you're paying attention to those key terms, okay? So when I say strawberry tongue, you say Kawasaki disease, right? In my course, I always say, when I say pass, you say boards, whatever. Y'all know the craziness that I do to make y'all remember. But when I say strawberry tongue, you say Kawasaki disease. Next, because I want to compare so you don't confuse certain things, because you hear strawberry cervix, strawberry tongue, everything. So let's do one of the STDs. So upon exam, the nurse practitioner notes a strawberry cervix. How should the nurse practitioner best treat? A, Flagyl, B, Rocephin, C, doxycycline, or D, none of the above? How will you treat? If your person comes to you, you're examining the person, you note a strawberry cervix, what is the best treatment? A, Flagyl, B, Rocephin, C, doxy, or D, none of the above? Anybody? Because what does strawberry cervix tell you? What key term or description do you think of when you see strawberry cervix? Because with strawberry cervix, you need to think of trichomonas, right? Trick. So with trichomonas, you treat with what? The answer is A, Flagyl. So again, if you do my review courses, this is what I talk about. So again, on the thing, when I say strawberry cervix, you say trichomonas. What does trick look like when we look at it under the microscope? It's like fish swimming, right? So I always say fishy and flagell. Trick has the fish swimming in flagell, and BV smells like fish, and you treat with flagell. Fish, flagell. Okay? So those are just a couple I just wanted to do really briefly since it hits on the strawberry description. So strawberry tongue, strawberry cervix. I want y'all to pay attention to. And just a little sidebar, do not confuse a strawberry tongue with a beefy red tongue. Two different things. Although it's red, think of a strawberry appearance versus beefy red tongue. Beefy red tongue goes with vitamin B12 deficiency. So that B12 deficiency, right? Pernicious anemia. So they have that the beefy red tongue. And I mean, you're going to notice it. It's going to look like beef. So I just don't want y'all to confuse that when they give those descriptions, okay? But just short and sweet, wanted to come on really briefly while I had a moment, go over this with you guys. The replay will still be up. I will upload it on YouTube as well, so you can watch it there. Trying to do better with just uploading my videos there too. So, all right, you guys, if you have questions, let me know. If you're watching the replay, I know it's midday. But if you have any questions or concerns, post it in the comments and I can answer it as I see those, okay? Otherwise, happy Thursday. Enjoy the rest of y'all's evening and meet me back here for the next video. All right, talk with y'all soon.